Good day, everybody. Welcome to Dental Voice, Season 2 with Zyrus. My name is Rolando Mia, and today I have, oh my goodness, I can't wait to talk to this lady, Amanda Hill, who's a registered dental hygienist who went to Old Dominion. So, how are you? Thank you for joining us, Amanda. It's such a pleasure to talk to you.
Well, thank you for having me. I am excited to be here today.
So I want to get right into this, and I have to ask you because I found out you wrote a letter to Dr. Anthony Fauci. Is that right?
I did write a letter to Dr. Fauci. Yes.
Okay, you got to tell. All right, you got to tell me about this. You got to tell us about this. What was that all about?
So it was pretty early on COVID, and Dr. Fauci was giving a press conference, and he was talking about the health disparities and how certain groups were really more at risk for complications from COVID. And in that, he said that it's really important when we get through this whole thing that we really need to look at healthcare and those healthcare disparities. And so I wrote him a letter to talk to him to let him know that when he's looking at these healthcare disparities, to not forget about dentistry and that to not forget that oral health is whole body health. And so I think so often in our nation, when we are looking at the healthcare system, we are only talking about, we take the mouth out for some reason, it's out there. And then we worry about healthcare from head to toe, but no mouth. And so I always say that dentistry and medicine have been social distancing before it was cool.
So wait a minute. So did you get a response?
I did not get a response from Dr. Fauci.
What?
But this was, I'm sure he put this away for once we get through COVID, and then he's going to call me to be on his task force for us to revamp healthcare and oral care, because oral care is healthcare together. And I'm there for you, Dr. Fauci.
Oh, well, first of all, I love the fact that there's a passion and there's an energy and that you're willing to do that and everything. Are you like a Fauci fan or something like that? Is this?
No, I wouldn't call myself a Fauci fan. I mean, I don't know what that's about. I mean, I like to keep my drinks cold.
All right. Okay. You have a Dr. Anthony Fauci koozie.
I do. After I wrote my letter, my amazing neighbors got me a koozie for my birthday. So now I have my koozie.
Oh, that is okay. So, first of all, thank you for sharing that. That's incredible.
Absolutely.
You are an educator, and you're, as a dental hygienist educator. That's fantastic. When you look at dental hygiene and when you look at the kind of the message about dental hygiene, what is the top thing that you have to get across or that you educate people about regarding hygiene?
I think that hygienists are more than just tooth pickers. And what we are here to do is to help you have health from head to toe, that the mouth is the gateway to the body, and that if you don't have a healthy mouth, you can't have a healthy body. And I think that's really important. I think the public is finally kind of jumping on board with us, which is great. Media is finally pulling in some of that things. But I knew this back when I graduated from high school or college in the 90s, that this is how it was. But it was really hard to convince people of that. Decay doesn't hurt until it's really bad. Yeah. But cholesterol doesn't hurt either. And yet somehow we think cholesterol is important, or we know that cancer doesn't hurt until it's really bad, but we would definitely deal with cancer the moment we heard about it. But bleeding gums, they've always bled. It's not a big deal. And so to really help patients understand that actually, no, bleeding gums is a big deal.
So that's holy cow. I love the context between, there are all these other things that don't hurt until it's the same thing. With the advent of COVID, with the advent of this coronavirus and the scare, I mean, think about it. Talk about psycho scare. 5-6 months ago when it all just broke out, hygiene was literally at the top of the heap of risk. So now you've got people who don't really pay attention because, I'm one of them. And then now hygiene is up there. What's the experience that you're seeing, or what's kind of your thoughts around exposure, risk, coronavirus, all that, and hygiene?
So the biggest thing I think that we need to step back and remember is that we've actually always been at the top of that risk ladder. So I in fact, just went back and I was reading a journal of the JAMA, Journal of American Medical Association, JAMA, their journal. And it was a 2004 article written by John Molinari talking about aerosols versus splatter and the risk to dental hygienists. So this was 2004. And if you read it today, you would have been like, oh, that was written like yesterday, right? So the conversation has been happening. We just didn't listen. And so I think coronavirus, what it really did is it made us start to listen a little bit more. And you know what? We needed a listening. Like we needed a good talking to, and it was time for us to start paying attention. So I think that's the first thing. I have temped in many offices. I'm a military spouse. I've lived all across the world. And I have yet to be in an office that has perfect infection control, that's doing all the things. And I think COVID was a great time for offices to say, oh, crap, like we've been supposed to be doing all these things. Like we better do some of these things. And patients are getting smarter and they're saying, hey, are you doing this? Like, you know, you're supposed to be taking my temperature. You're supposed to be doing this. I mean, so I hope that through COVID that some of these changes happen where infection control is much more noted. I hope that the front desk never, ever once again utters, don't worry, you can come in if you're sick. She wears a mask. Like I never want to hear those words come out of a front desk ever again in my life. Like we need to start being smarter about not just PPE, because really PPE is the last layer of defense. We need to think about those environmental controls and we need to think about patient screening and all those kind of things. And we should have been doing that long before COVID.
Wow. So then there's been so much talk, you know, kind of dovetailing into the comment that you mentioned about, you know, you've been in so many different clinics or offices and nobody does infection control perfectly. It makes sense that COVID is bringing this more top of mind. There's been a lot of dialogue and it continues where hygienists are feeling apprehension, fear, I don't know what the word is, but are not fully comfortable because offices are not, you know, really, I don't know, would you say they're not taking it seriously or they believe, or there's a belief that things are okay? Because we talk to a lot of offices who are way over the top in safety, but as it turns out, there are also a lot out there that are not. Is that what you're seeing?
Absolutely. I mean, you definitely have, you have some older dentists that are like, I made it through AIDS. I don't need to worry about this, you know, and you're like, what? No, we still need to do these things. And then you have offices where, you know, we're walking around in like spacesuits and we look like astronauts. And so, and I'm not saying that, you know, that's wrong. But we definitely need to figure out what the entire office is comfortable with. Definitely need to follow the guidelines, you know, the CDC guidelines, whether your state has adopted the CDC guidelines as required or not, they're good guidelines. So, you know, look to those guidelines. But really, I think the big thing about hygienists, assistants, front desk, you know, not feeling comfortable is there's some offices out there that aren't having the conversations as a team. And this really has to be a team effort. Everybody needs to be able to voice their concern, their opinion, talk about what they heard. There's so much sort of false, you know, narratives out there. And then there's real narratives. And then we change. We have guidance and interim guidance. And what does all that mean? And so to be able to sit down and have a thoughtful discussion that involves critical thinking, that where you figure out what's the best for your office is really key. I think when somebody just says, this is the way we're going to do it, and you're coming back tomorrow and you're doing it, that's where a lot of the breakdown has occurred. And so the office that came back slowly, that they had many offices. I know I have lots of friends where they had like a test day where they just brought in their family and they, you know, did dental work on their family members and they cleaned their family members' teeth, but they got to try on the PPE. They got to feel what it was going to feel like. they slowed down a little bit. They didn't, they weren't seeing somebody every 50 minutes. Cause I got to tell you, that PPE is tiring. I mean, no matter how you slice it, it's hard. Last week I was in the op and I had my N95 and that thing got put on at 8 a.m. and it didn't come off until 1:30. I never took a sip of water in that amount of time because it was just, I didn't have time. It was attached to my face. So I get where the fear comes from, but I think that we need to be really smart about how we treat patients and how we treat those protocols. And those protocols I was talking about our environmental controls that we think about, not just your PPE and what you're doing, reading your instructions for use on your disinfectant, making sure you're using these things like they're meant to be used. I think so many of us assume that new product works just like the old product when it totally doesn't. So those are really important things. Did I get off topic? I might have.
No, that was perfect. Thank you for sharing that. the thing, and I hear it from both, actually all sides. There seems to be a dichotomy with regard to the engagement in the practice. The ones that are doing incredibly well and doing what you mentioned, and then there's a population out there of team hygienists, dental assistants who work in environments where they're not comfortable, and there's friction. There's quite a bit of friction. What advice would you give those folks who are in that environment? How do you overcome that initial, to say, hey, doctor, he, she, they, I need to talk to you? What advice would you give those folks?
So first off, take a deep breath and get your courage up, because it's really hard to have those difficult conversations. But if you're not willing to have those difficult conversations, then that means you have made the decision to be stuck. So you have to decide, like, okay, all right, I'm going to be brave. And so you're ready to be brave. And so come to your doc, not in front of a patient, not when you're rushing from patient to patient, but say, hey, doc, I really have something I'd like to talk to you about. Can we set up a time? And then when you talk to that office manager or that doc, whatever, use a lot of I statements. Hey, I have been reading this. I have some concerns about this. I would feel more comfortable if we had this to help me treat patients. So a lot of I statements, but try to base your I statements in some facts. There's a lot of great data, a lot of great information out there. And so really find ways to bring that conversation. But I got to tell you, just complaining on a Facebook forum or complaining, the front desk and the hygienist hiding in the back room complaining is not going to move the needle forward. It's actually only going to increase your angst in your chest. And so you have to decide, and it's hard. I am so not the one telling you that, this is easy. It is hard to decide that you want to have that sort of confrontational conversation. But when you come with, kind of that open heart and that I statement, it really should help diffuse the situation. And hopefully that will open those lines of communication so you can get that, maybe you need some sort of high speed evacuation suction. Like that's the thing that you've decided you really need. Or maybe you need new hand instruments, or, there's something that you need that you're not getting, and help them understand why.
That's cool. Yeah. I could see how anytime you're approaching a difficult situation, it gets difficult. And I think it's important to really frame it instead of just saying, I need to talk to you. Boom. Makes sense.
Yeah. So don't say you don't give me any of the stuff I need. Hey, I would feel much more comfortable if I had this, I've read this data, I've seen this information. I.
So how did you overcome, or did you have fear going back? Did you have
totally
a little trepidation? How did you overcome that?
Oh yeah. In the beginning, I was like, no way, forget that. Like, I'm not going back in the op. I'm done. And that was just sort of that initial thing. And then I remembered that, oral health is whole body health. And thankfully the news media reminded me with these great studies that are coming out that talked about, poor oral health leads to more extreme COVID response, and I remembered these things, and I remembered why I got into hygiene to begin with. So I got back to the remembering, but it was easy. It was easy to get sucked into the fear. There's just so much fear. And I think the big thing with COVID is, as a hygienist, as a dental professional, we base so much of what we do in science. I mean, I can rattle off some good science about periodontal disease, and I can rattle off some good science about, diabetes, and COVID didn't have the science. Like, I couldn't rattle off any science. And what I thought was science one day, but got debunked the next day and got contradicted the next day. And that was scary. There was no hard data to hold on to. And so I think that was part of what made it scary. And so I think once I was able to kind of take a minute and settle down and remember, why we do what we do. And then I think being told I was non-essential, I think I might've gotten a little like, what? Hang on. What do you mean? I'm essential. Exactly. Right. So a little bit of that also kind of probably came into play too. But remembering that, oral health is whole body health, and how important it is that we be that sort of beacon for patients. And sometimes, maybe we're the first healthcare professional that they're willing to see post COVID. And so really trying to help them remain healthy.
So how did you separate? How did you separate all just everything that you're hearing? I'm going to call it the hysteria and craziness with facts. How did you separate what was real and what was fact versus fiction?
I just listened to my buddy Dr. Fauci. Just said, "Oh, okay, that's what you said." No, so I do think. I mean, it was taken a little bit of time to look to those professionals that you already trust. The people that the infection control experts that I already trusted. John Molinari. What was John Molinari saying? What was Shannon Mills saying? What was OSAP saying? What were they telling me? Because I know that when they're talking, they're not going to talk from a place of pushing a product. They're not going to talk from a place of trying to get back into the op before the op was ready. Because I think that's where a lot of hygienists and assistants got spun up, is that offices were rushing back without the proper PPE, without any new infection control practices in place, without critically thinking through the process. So I looked to those people that I knew were going to do that critical thinking, and we're going to do it data-based, and we're going to do it based upon the science, the best science we had at the moment. And then weren't afraid to say, okay, I know we said that last week, but now we're changing it because we have new science, because that's how an emerging disease works. And so I really kind of leaned on them and tried to stay away from some of the Facebook forums, and certainly stay away from the national media, which, was feeding all sorts of stuff into my brain, and it gave me angst. And so I had to step away from that.
Wow. So appreciate that. And it so makes sense. The other thing that everyone is talking about, and it's interesting, HIV was all bloodborne. So we got into the gloves and the masks and all that. And there's been a lot of, people got comfortable with that. But all of a sudden, the fact that there's a question whether or not COVID is in aerosols, all of a sudden aerosols became a huge thing, because fomites, good, wipe it down, right? Droplets, great, wipe it down, cover yourself. But then all of a sudden, now you got this aerosol. How did you, or what are your thoughts on aerosols, and how is that affecting kind of how you're treating patients and kind of the experience that's happening around that?
Yeah, so aerosols, and particularly because we still don't understand, how long does COVID live in the air? Is it 15 minutes? Is it 7 hours? Like, I don't understand. How far does it go? Is it going to go 5 ops away? Is it going to just stay in my op? And so I think that's where some of that, there's residual fear that exists, hence the N95 mask. And so, now I have an N95 mask. I have a level 3 mask. I have a face shield. I have my loops. Then I have a face shield. Then I have a lab coat that isn't coming off, and a disposable lab coat, so there's a lot, it's a lot to put on. I'll be interested as the science goes on where we settle. However, one of the big things that I had started to do kind of pre-COVID, but not all the time, was high speed suction. And, that article that I mentioned that John Molinari did back in 2004, he talked about the importance of hygienists when using ultrasonic scalers, when using air water syringes, when using air polishers, that we should be using high evacuation suction. That was 2004. That was a long time ago that recommendation came out. I never heard that. I missed it. I don't know where I was. I was having my third baby, I think. And so I totally missed that recommendation. But so now I'm figuring out ways to incorporate high evacuation suction into the whole appointment. It should have been there to begin with. And so if that's the big change that comes out of hygiene that we now realize, like you throw that in. I was reading the stats in the article that John Molinari posted, and he was saying by bringing in high evacuation suction while using the Cavitron, you reduce aerosols 98% from an ultrasonic scaler or a powered scaler, and air water syringe 99%. So, but another big study that came out in the journal Periodontology just this past summer took, they captured the aerosols within an operatory and figured out where the aerosols were coming from. And the vast, vast majority of those aerosols are not coming from aerosolized saliva like we imagine. In our brain, we imagine you put that ultrasonic in and every single spit particle has just gone into the universe. But in reading this study, I really understood it even more today. That ultrasonic scaler is shooting out so much water. That's actually the vast amount of aerosols that you're consuming, that you're breathing in, your patient's breathing in, are coming from your dental unit water lines. So a huge thing, if you are not testing, if your office is not testing your dental unit water, you got to start like today. Look, I'm a huge fan of dental unit water line testing. These are quick pass water tests from ProEdge. And you just fill this little guy with water. You can even do a pooled sample. So you can do a little bit from your air water syringe, a little bit from your ultrasonic scaler, anything that has water in your op. You fill it up with water. You put that guy in, you lay it down for a minute, then you dump it out and you let it sit for 48 hours. And then it'll grow the colony forming units. And then you can tell whether your water's safe or not. And if it's not, you need to shock your water and you need to maintain your water. That's what you're breathing. Way more than you're breathing your patient's aerosolized saliva. Not that that's not important, but way more water from your dental unit water line. So way more Legionnaire's disease, Mycobacterium abscessus, Pseudomonas, all kinds of yucky stuff. I know, right?
Wow. It's interesting. People show these instruments, high-speed instruments, and there's all this stuff coming out. And that's not even coming from the patient. That's coming from the water line. So really appreciate the context around it. That's absolutely amazing. Yeah. How do you, with regard to the things that you've seen, you personally have seen for getting rid, in addition to HEV, are there other systems that you've seen or used that are effective or you feel comfortable with?
So there definitely are those extra oral units. I haven't actually used one yet. You know, they have like, they bring in they roll in the little cart and it sits over the patient's head. The office where I currently work, they are actually the field test for a new product called Life Air. And it's actually a whole HVAC system that's cleaning the entire office's air, changing the air over faster. They use it in vitro fertilization labs, which is interesting. So, so they're really trying to turn over the HVAC is turning over that air really fast so that, if COVID lives in an aerosol for 16 hours, if you're changing over the air, it's not living that long within your op. So I've experienced that. I can't say that like I walked into the office and I didn't feel or notice a difference, but they tell me it's working. I don't know. But definitely, and then I certainly using pre-rinses for our patients. So perhaps we're decreasing some of the bacteria in their mouth. I do question how quickly our saliva changes over though, and how effective that is. But if it's not going to hurt us. So why not try that as well? So there's definitely different things out there that people are trying, that people are happy with, to do. But I really think that high evacuation suction with that bigger borehole, because that's the big thing, right? That's your wheelhouse, right, Rolando? It's understanding like the low speed doesn't have a big enough, right? Isn't that the term borehole? Is that the right?
Yeah, people talk about this
8 millimeter borehole.
Well, it's a function of the suction. So of course, Michelle Strange was on and saying your suction system is really critical, because if that's not sucking well, it doesn't matter what you have.
Your suction doesn't suck; it sucks.
If your suction Doesn't suck. Absolutely. I think the other thing that we've heard of layering different systems, because not every single one of them is the end all, is a silver bullet for regard to that. Have you seen any of that type of stuff?
Yeah, absolutely. I think that you have a fancy product, don't you? Do you use you don't use our system, do you? I have used Isolate before. I have not used the Isolate 2.
Oh, okay.
Right? So I haven't used that one yet, but Isolate I adore. And it's oh my gosh, it is the greatest. Oh my gosh, it is the bomb when placing sealants too. Oh my word, talk about a dry field. Oh, it's glorious.
Thank you for that. So
yes,
let me ask
absolutely. So products like that definitely make you more comfortable as a clinician.
So let me ask you this. In the context of COVID and everything that we're finding out, how do you see this affecting us going forward? Do you think there are going to be a lot of changes that are still going to be coming down the road with regard to how we're doing? Or do you feel just doing more and being a lot more mindful of what's going on is going to be is it? What are your thoughts on that?
So I think there's two discussions here. One is, what are we doing in the clinic? And I think hopefully, I hope that this brings a whole new awareness to infection control. I hope that everybody is testing their water now. Do you know only 33% of offices test their water? 33. That's not very many. So that's a lot of people that are breathing in stuff water that maybe hasn't ever been treated. So I hope that we're getting better at infection control. I hope that people are, if you've never downloaded the CDC app, they have a free app called Dental Check. It's this cool free app, and you can actually go through and do a checklist in your office to pretend it's almost like being your own inspector, and you can see whether you're doing all the things, because there's a lot of things to do. And so that really helps you figure out if you're doing the things. So I hope that that's part of it. I hope that we're always using high evacuation suction. We should have been using that back in 2004. I mean, per John Molinari. Now, the next question is staffing and what our teams look like. And I think that's going to change for a little while. At the very least, until we get our kids back in school. And so, dentistry is 98% female. Typically, the female is who is taking care of the children. And so a lot of clinicians, front desk, dental assistants, dentists, hygienists are torn between trying to help their kids with virtual school and trying to be in the op at the same time. And so I think that offices are going to have to figure out how to be more flexible. So one of the jobs I have, of my many hats I wear, is I work for Dental Post, which is a dental job board. And they recently they've been doing job trend reports. And their latest job trend report said that 77% of new grads want to make sure that they have a flexible work schedule. So maybe that means you have a morning hygienist and an afternoon hygienist. So instead of having a Tuesday, Thursday hygienist like you used to, maybe you're doing half days, maybe you're staggering or something like that. You're doing more job sharing that allow people some of that flexibility that they're looking for. But offices are having a hard time finding the staff that they need in general. And I think a lot of that has to do with our children at home. Certainly some of it has to do with fear as well. And so I think when offices are searching for someone, a big thing, instead of writing their ad to be like, we need a hygienist that will do all these things for us. The ad almost has to flip now. And it almost has to say, we want you, and this is what we're going to do for you. Because it's kind of a job seeker market. And it's just in how you phrase it. Like it's pumping up your office. It's saying, we brought in the PPE. During shutdown, we had awesome communications. We continued to have virtual happy hours, and we, listened to our staff, and we respect the education of our dental team members, which I think sometimes in some offices, that doesn't always happen. And so being able to woo someone to your office, I think is going to be really crucial, at least for a while. So I think there's kind of two ends to this sort of change and what dentistry is going to look like. But I hope upon hope upon hope. I hope upon Dr. Fauci that we really work hard at connecting whole body health to oral health, and that patients really get their help. We can get patients there with us. So
really appreciate that. Yeah, I love the context around having an understanding. There is a dearth of hygienists out there now. Some retiring. The context of work-life balance has become huge now, especially as you've mentioned with kids being home and having to homeschool and having an understanding of that. And then also it's really important to note too that it's not just about my way or the highway. It's about a collaboration, and we're seeing that
yeah.
successful practices are collaborating really well. That is so cool. If you were kind of to sum up for our viewers, for people who watch here, and kind of with regard to hygiene and the dental office, what's a closing message that you'd like to give folks who are here visiting us and going to be listening to this over the next several days?
Oh, I think the big thing is always keep learning. And particularly right now, there's so much new information that's coming out. And so, I think at one point, sometimes people view their job as, okay, I see patients from 9 to 5, and then that's my job. But always continue to seek more information, because when you know more, not only can you treat your patients better because you have more information, but you remain excited about your profession, about dentistry.
Yeah.
You remain excited about treating patients. You feel empowered to be like this amazing difference maker. Like, I feel like I can seriously do some stuff. Like, I can help someone because of what I know. And that's truly because I continue my education all the time, that I'm always watching webinars and I'm reading my dental magazines when they show up, and I'm active on dental forums so that I'm understanding what's new and what's cutting edge, and being able to base that in data and in science, not just on, the fly by night, thing that just came in, but, something that's true and works. And then being able to understand, like I was talking, when a crisis happens or when something new comes aboard, knowing who to look for that is going to be that resource that you can trust. And so yeah, my biggest piece of advice is to never ever stop learning, because if you keep that way, I got to tell you, you're going to remain excited about what you're doing.
That is so cool. Thank you for that. Thank you for everything that you've said to us. I love the kind of the perspective that you bring here. I learned a couple of new things about it. The waterline, that's incredible. At some point here, months from now, as we get through this, would you be open to joining us again and kind of sharing what's going on?
Of course, I would love to, without a doubt.
So if people wanted to ask you questions or wanted to kind of learn more about some of the things that you've been doing, or presentation or podcast you're doing, what would be the best way for them to do that?
I'm Amanda Hill RDH on Facebook. I'm AmandaHillRDH.com is my website. And my email is AmandaHillRDH@gmail.com. So you can get me on any of those. Oh, and Instagram, Amanda Hill RDH. Thankfully, there aren't a lot of us. So yeah, so it's pretty easy to find me, I think.
Cool.
Yeah.
Cool. Hey, thank you so much for joining us. Those of you who, if you like this, please share it. If you have questions for Amanda and you want to learn more about Dr. Fauci, no, I'm joking about that. But if you
know Dr. Fauci, feel free to give him my email and remind him that I wrote him a letter. Oh,
absolutely. We got to go find Dr. Fauci. That'd be cool if he joined us. If he did, you're coming.
Yeah. I'll bring my koozie.
If you like this content, please share it. If you have any questions for us, really appreciate it. Amanda, thank you so much for joining us. Thank you for taking the time and sharing your perspective, your advice, and it's an absolute pleasure getting to know you, and I look forward to talking to you some more.
Yolanda, thanks for having me.
Have a great and safe rest of your week. See you, bye.
Bye.